Hi, I'm Dr. Gopathi with RISE Medspa. I wanted to talk to you a little bit about what facial balancing is and why everybody's talking about it recently. Facial balancing is something that we've been doing in our practice for years. What does it actually mean? It means looking at your face and looking at the proportions and making sure we're not just treating one area of your face, but really addressing it as a whole, because everybody sees your face as one thing, not just your lips, not just your cheeks, not just your chin. So we want to make sure we're addressing everything together. The best way that I like to do it is with the one-on-one in-person consultation. What I do is first start by talking to you about your goals and what you're looking to do. And then I will take scientific look at your face and look and see what is proportion and maybe what is not, and really try to give you an assessment that will keep your face looking like you, but keep it looking very natural with small little adjustments. The areas that I love to treat for this are going to include the lips, our smile lines or nasolabial folds, also our cheeks, jawline, and chin, with small little tweaks to potentially all of those areas or a few areas depending on your need. We can really make you look much more balanced, much more youthful, and much more refreshed. So for full facial balancing, typically I use soft dermal fillers. The brands that I like to use are all FDA approved and made in the United States. My most commonly used products are from Allergan and from Galderma, which include the Restylane brand and the Juvederm brand products. I also like to incorporate Botox into the mix because I do think that it's great to add volume in some areas, but we also need to address some of our facial movements and decrease static lines as well. So typically downtime is going to include just a couple of days where you're going to have some swelling and potentially some bruising, but I do recommend arnica before treatment and continue it throughout treatment as well as a couple of days afterwards to reduce that risk. I do think that, try not to get this done if you have any major events coming up within the next couple of weeks. Really give your body time to process, the fillers and everything that's going on so that you have your final end result before you're going to a major event. Typically, these fillers and full facial balancing can last about 9 months to possibly 12 months. So that's probably when you would need a refresh. I'd love to see you for a one-on-one in-person consultation so that we can see what areas you might need full facial balancing. Can't wait to see you.